Can I ask you if the Austin policy to require private employers to do paid sick leave is going to be a regret in 4 years, if you actually get there with it? Because Paul Workman wants to ram it up your nose in the next session. The bathroom bill discussion is instructive, I think, during the last session, where the fault line became what we can require of private businesses versus what we can, whether or not we should, require of people on the public side. What you've done is taken the extraordinary step of saying, unlike with the minimum wage issue, where we're just going to pay people on the public sector what we can pay, we can't affect business on the private sector, that you're going to require private businesses to do paid sick leave. How can you do that? How can you require them to do it?
The same we just did. You know, the minimum wage, I think, argument is instructive. There are cities in the country that are establishing minimum wages where their state governments are not doing that. We can't do that in Austin because the state legislature hasn't given us that power.
I guess I'm asking, why is it a good idea to mandate behavior by private businesses?
It's a good idea to not have sick people going to work. We can't have people that are in restaurants serving food when they're sick. There's a public safety issue. Our public health professionals came to us and said, if we had sick leave that was universally available to people that worked here, we would be a healthier and safer community if we did that. That's why you do that in the city, because there's a public reason to do that. It is something that makes us a better city, to have sick leave available to the workers in our community.
But what about the pushback you're getting from business? Not like big evil corporate America, but like Amy's Ice Cream and Book People and Chez Z, iconic Austin businesses who say, Mr. Mayor, we love your heart. The head in it's your head that's the problem here. You're not thinking this through. This is a good idea in theory, but the implementation of this is problematic for Austin and for the economy. I mean, nobody wants people to be sick going to work. I don't want people at Chez Z who are sick serving me food, or at Amy's Ice Cream serving me ice cream. I stipulated. But is this not, from a public policy standpoint, a hornet's nest? And aren't you just inviting the same legislature that put a target on your back last session to put a target on your back again this session?
So I've had the opportunity to speak with a lot of the small businesses, and I did, and I understand the concern, and it's real. But when you look at the over 40 other cities that have already done this, and the over seven states that have already done this, the impact on businesses that is being reported is nothing like what people fear that it might be. So if you look at the actual data and the actual evidence, it just does not bear out. And I have no reason to believe that it's going to happen here differently than it happens in other places.